I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 31. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
Hey folks, Dr. Joe here. Glad you could spend a little time with me today. What we're going to talk about today is chronic pain. Because as a chiropractor, my team of doctors and I, we see a lot of chronic pain patients. And the definition of chronic is, I've read different definitions. But one of the definitions that kind of makes sense to me is the pain lasting longer than it's expected to. So, for example, you get in a car accident, and the car is hit, and your head snaps back and forth, and the muscles and ligaments are torn. By the way, if the car is damaged, you're damaged 100% of the time. I don't care what the insurance companies say. But the head snaps back and forth, the ligaments are torn, and we know with a series of chiropractic adjustments and proper therapy, we're looking at about 8-10 weeks of treatment maybe, and you should be resolved, somewhere around there. Now, it's 5 years later, you're still having pain from this car accident. We got an issue. And chronic pain is interesting because that's one of the things, well, amongst all pain, I guess, that has led to the opioid epidemic. Because opioids are drugs that work really well to block pain. The problem is this. Once you start taking them, your body stops producing its own natural painkillers. And so now when you start coming off the opioids, any little thing that normally your body isn't going to respond to, like, that really hurt bad, now becomes super sensitive and you want to take more opioids. That's called an addiction. So people get addicted to these things, and somebody asked me the other day, which was interesting, I never thought about telling anyone this, why does it kill you? Well, what it does, it slows down your whole body so you don't feel the pain. Eventually it gets to the point where you just stop breathing. Your heart stops. So it relaxes you, if that's the right word, to the point where you can die. So instead of treating the symptoms, and I'm not against treating the symptoms, by the way, in pain patients, what if we got to the cause? What if we got to the reason why you're having the pain and not just treating the pain? So that's going to be the approach we're going to talk about today, why it's so serious to deal with the pain. The pain is a warning sign. It's telling you something's wrong. And if you ignore it, it's probably going to get worse. And I always tell my patients, they say, Doc, how do I know to come see you? How do I know I should come see you? The reason you should come see us is if the pain lasts for more than 3 days. After 3 days, if you're still having headaches, neck pain, back pain, shoulder pain, and it could be a car accident, a sports injury, a friend of mine just went on vacation, sent me a text and said, obviously I can't go on vacation without bringing my chiropractor with me. My neck is killing me from the plane flight and I can't move. So I thought, well, it's true, but it's hard to travel with your own personal chiropractor. A lot of people do, though. I mean, a lot of sports teams do. Rock bands have their own chiropractors with them because they try to get to the cause of the problem and not just treat the symptoms. And they understand that their bodies, an athlete or musician, their bodies and their voices is how they make their living. Well, why shouldn't you get that same care? Why should you suffer needlessly in most cases? So let me talk a little bit about the medications that are often used and what may happen to you. So we're going to talk about some problems with over-the-counter painkillers. We're going to tell you what to do about it, I promise you. But I got to build up to this, As a radio show host, we got to build up to things. So if you take non-steroidal anti-inflammatory drugs, they're called NSAIDs. Ibuprofen, for example. Ibuprofen helps with inflammation. Acetaminophen helps with pain. Now, many times the pain is caused by the inflammation. Get the little semantical thing there. So that's why sometimes you may need to take ibuprofen. If it doesn't work, you might want to try acetaminophen. Now, they're rough on the stomach. The ibuprofen, and if you take aspirin, of course. And they're just as rough on the lining of your gut. Because you always hear about bleeding of the stomach if you take aspirin or ibuprofen, but it can also cause the gut, the small intestine, to start to bleed as well. They create ulcerations and inflammations in the gut, and the damage is known that can happen is called leaky gut syndrome. Now, I've been talking about health and wellness for about 35 years now. Been in practice 33 years. I was lecturing even when I was a student. And we talked about something years ago called leaky gut syndrome. And it was poo-pooed. It's not such thing. It doesn't make sense. Leaky gut. How can your gut leak? You die if your gut leaked. What happens is in your gut you have cells. In some places it's actually just one cell thick. And if those cells tear, if they can become inflamed and tear, you now have a portal, essentially, for these undigested pieces of food to get into your body. And when it gets into the blood system, the immune system says, we don't know what that is. That's a foreign object. We got to attack it. And so now you have an autoimmune condition, or beginnings of an autoimmune condition, where the body starts attacking in the blood, but it can start attacking itself and can start attacking the inflammation in the bowels, like Crohn's disease or celiac, where the body is starting to attack itself. So now we have a big problem. So you're taking NSAIDs, non-steroidal anti-inflammatories, to help with the pain. It causes swelling in your gut, causes the immune system to go crazy, puts little holes in your gut, big chunks of food get absorbed into your blood system, the immune system starts attacking it, and now you can have allergic reactions. That's what allergy is, the immune system attacking a foreign protein. So you might have runny nose, you might have fatigue, you might have swelling, because the immune system can cause a swelling reaction. And so, yeah, I don't want you to not take the pain pills, because sometimes you need them. I mean, I have a chronic injury in my neck, I got hit by a car when I was 10 years old. And every now and then it flares up. And when it does, I don't have no problem taking acetaminophen. But then I grab one of my doctors and say, hey, listen, find out what bones are out of place in my neck. I get adjusted and the problem solved. So there's a problem with this leaky gut because you can't absorb your nutrients properly, but you can absorb partially digested food, and that becomes an issue. Your gut is a very sophisticated filter, for lack of a better word. You don't want to mess with it, because when you do, there's always going to be consequences. And one of the problems that can occur is your gut can become inflamed, and that inflammation now can become systemic. What that means is it goes through your whole body. And that systemic inflammatory reaction can get into your brain. And if it does, it can cause brain fog, it can cause depression. That's why so many people with things like celiac disease, where gluten will cause inflammatory reactions, Crohn's disease, even hiatal hernia, acid reflux, they have an emotional component. Now, with the stomach, there's another component we can talk about if we have time, where your body's not breaking proteins into amino acids, and amino acids become neurotransmitters in your brain. We talk about that a lot. But if your gut is inflamed, it can cause an emotional issue. And when you have an emotional issue, anxiety, depression, brain fog, that can affect every aspect of your life. Your work, your play, your family, your boyfriend, your girlfriend, your husband, your wife, your significant other, your children. So it's so important that we get to the cause of the problem, not just treat the symptom, if we can. And in most cases, we can. There are some very rare cases that we don't get good results with, but those are extremely rare. And I can't even remember a case. I've been in practice 33 years. I can't remember a case where we didn't get at least some results. Usually we get way more than the patient even expects. So talking about chronic pain patients, we're starting out by talking about over-the-counter painkillers and why they have some side effects and what to expect. I want you to think about this too. I'm taking ibuprofen. Well, suddenly I'm having horrible gas or bloating or diarrhea or acid reflux. I'm getting moody and the inflammation is there and I'm fatigued all the time. Never correlating the two. That's what I'm trying to get you to do today. So what happens is NSAIDs, non-steroidal anti-inflammatories, disrupt the gut bacteria. Now, in your colon, you have over 100 different types of bacteria. 70% of your immune system is in your digestive system. Some people say 80%. So we'll say that would be conservative, 70. So if the bacteria is thrown off because you took non-steroidal anti-inflammatories, now we have other problems that can occur. One of them is a systemic yeast infection. In your gut, in your small intestine, you have bacteria and you have yeast. And you have viruses and other things too. But let's just talk about the bacteria and the yeast. And the bacteria and the yeast fight for food. And now you need both. They both have a job to do. But if the bacteria start to die off, the yeast now don't have any competition for food. And when you feed something, it gets bigger and multiplies, makes baby yeasts. And now these yeasts are sitting around in your colon and they start to overtake the colon. And they say, I'm bored. I want to go on vacation. So they can get into this leaky gut, these holes in your gut through leaky gut, get into the blood system and start to travel around your body. And they like to set up shop in warm, moist places. Well, where might be a warm, moist place? Your genitals, your feet, your rectum, your mouth, your armpits. If you're fat, rolls of fat underneath the fat. And so now you can have a systemic yeast infection coming out through the body. And I've had patients already that smell like yeast, smell like bread, because the yeast is so overgrown. And when that happens, it's tough to manage. And we have a nutrition protocol that we put patients on, but we're looking at months of managing this to try to kill off the yeast, because yeast don't want to die. They're very happy. So taking the non-steroidal anti-inflammatories can lead to gut issues and immune problems, and that can cause disease processes as well. 60 to 80% of, we say, people that develop gut inflammation within 24 hours of taking an NSAID start to have this reaction. Wow. So let's say 80% of people that take it have this gut reaction. 50 to 70% of people who take them long term will develop chronic small intestine inflammation. Initially, that might present as feelings of bloating, gas, changes in your bowel movements, but over time, you start to see the fatigue, and then you start getting food intolerance, where maybe you used to be able to eat a cracker and not have an issue. Now suddenly you eat a cracker and you have this full-blown allergic reaction. Well, that's occurring because your body just become sensitized, and that's not a good thing because you have to be able to eat. You have to be able to function. I'm amazed how many patients come in our offices. And if you're in the Atlanta area, by the way, we have offices in Marietta, Duluth, and Stockbridge. And I know the show's heard all over the world, but we're based in Atlanta. So patients come in and they'll say, well, doc, I can't even eat anymore. Every time I eat, my gut hurts so bad, and they're losing weight, and they're getting sickly because they're not absorbing nutrients. And so what we have to do with them many times is check to see, first of all, we got to get the cause of the pain. Why you're here, neck pain, back pain, headache, shoulder pain, numbness, tingling. I sprained my foot. I had a relative not long ago who was elderly, and she stepped wrong and twisted her ankle, and her foot was in so much pain. Doctors couldn't figure out what it was. Finally, I said, get an MRI. She got an MRI, and sure enough, she broke her foot. And now she's in a cast, and hopefully it's going to heal. But pain is a big issue. And so you take the pills to cover up the pain because pain is debilitating, but now there's side effects as well. So if you have the pain problem, my team of doctors try to get the cause of it. It might be a bone out of place, might be a pinched nerve, might be a torn ligament. And as chiropractors, we're really good at analyzing all that and fixing it if we can. If we can't, we refer you out to someone who can. But then we look at the digestive system. And if the stomach is pushed up against the diaphragm, you might have acid reflux, heartburn, burping, gas, bloating. And we need to massage or pull the stomach down away from the diaphragm and get it to relax. Because if you have digestive problems, that's a very serious warning. It's just like pain is a serious warning. Digestive problems are a serious warning. And to ignore them, very risky thing to do. Because chances are they're going to get worse. Liver damage. Acetaminophen doesn't just cause gut ulcerations. It's a problem that can result in liver damage in sometimes weird ways. This is why, as a doctor, I train my interns and I train my associates to be an investigator. Let's sniff around and see if we can figure out where it's coming from. Things like alcohol can interfere with the way your body breaks down acetaminophen, even if you're taking normal doses. I think it's over-the-counter medication. It's no big deal. I can have a beer. It's no big deal. Yeah, but that can be a problem. You lead to potential levels of acetaminophen in your system, and that can lead to liver damage. So when you take acetaminophen or anything in your body, it has to be broken down, metabolized, waste products are passed out. If you're not breaking down and metabolizing properly, you can build up over time issues. Painkillers that contain caffeine can stress your liver and interfere with sleep. So if you take an aspirin, chances are that aspirin has caffeine in it. And so what happens is you're taking the aspirin, no big deal. I have a headache. I take an aspirin. Now I can't sleep. Why can't I sleep? Why can't I sleep? It's because you took the aspirin with the caffeine in it. Make sense? So you got to be a little investigator there. Kidney damage. Along with the stomachs, your kidneys are major site of production of what's called prostaglandins. And these are hormones that non-steroidal anti-inflammatories are designed to quiet down. Now, prostaglandins, there's two types. One increases inflammation. The other one decreases inflammation, generally speaking. So if you have an injury, I scratch myself, well, suddenly prostaglandins are being released that's going to cause an inflammatory reaction. Then there's counter prostaglandins that'll help bring down the inflammation. But if you're taking non-steroidal anti-inflammatories, bringing down the inflammatory reaction, that can become a problem. You're supposed to have this normal reaction. So it controls acid secretion in your stomach. Prostaglandins help the kidneys fulfill their function of removing proteins and waste from your blood. So prostaglandins do a lot. And if you're taking these non-steroidal anti-inflammatories and prostaglandins aren't controlling acid production in your gut, you're not breaking down your food properly, which causes an inflammatory reaction, which then goes throughout the system and causes other health problems. So something as simple as an acetaminophen, or ibuprofen, becomes a problem. And again, take it once or twice, no big deal. But how many of you take it every day? Raise your hands. How many people take it more than once a day? Raise your hands. A lot of you. And that's when it becomes an issue. So kidney damage can occur. Too many prostaglandin inhibiting non-steroidal anti-inflammatories can affect the process of how your body detoxifies proteins. It can lead to kidney damage, buildup of waste products in your blood system, and now we have other problems too. So be careful. One thing you can always do is if there's ever liver damage in a serious level, the eyes become yellow. The white parts of the eyes start to look yellow. The skin starts to look yellow. If you're on medication and you start to get that, get to your doctor right away. Make sure you get a blood work done. Your medical doctor can do blood work, and he can test the kidneys, he can test the liver, and see if there's a problem. If there is, you don't want to ignore that. So prostaglandin produces inflammation, and that in response to the damage that the body is experiencing. Now, again, inflammation isn't always a bad thing. If I scratch myself, I should have some inflammation. The inflammation cleans up the damage and then sends fresh cells in to heal. When the inflammation gets disrupted, that's when the healing gets disrupted. So if you're taking nonsteroidal anti-inflammatories, it can disrupt the inflammatory reaction. You've got a problem. And that's a fine line, because we as doctors are trying to deal with, you need a little inflammation to make it work, but too much is a problem. But when you take too many medications, then it really becomes an issue. So again, as chiropractors, we're always looking to get to the cause of the problem, not just treat the symptoms. So I tell my patients, whenever there's an inflammatory reaction, you got to change your diet. You got to get on an anti-inflammatory diet. You got to make sure you have all the bones and muscles that are out of place put back in place. And then you want to make sure the gut is working. If you have acid reflux, heartburn, we have to adjust that. So my team of doctors, we're really good at dealing with pain patients. We get pain patients literally from all over the world come to see us. So if you'd like to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge in the Atlanta area. Go to my website, drjoe.com, or just Google Dr. Joe, number one Dr. Joe in the world, and we'll come up first. And we'll set you up a time to come see us. Now, we accept people with insurances. Many times, if we're not even in your network, there's out-of-network benefits. So don't get bogged down with insurance. Call us if you have questions, and we'll verify everything for you. But if you want to make an appointment for you, your friends, your family, and your children, because if children are healthy when they start out, they have a lot of health. They have a much healthier life. If they're crooked, have bones out of place, it's going to cause problems now and in the future. So if you have an issue, love to come see us, drjoe.com. We'll set you up a time to come in. We can do a nutritional workup with you as well if you'd like. We're going to talk about nutrition today too. Don't worry, we always talk about nutrition. And the website's there 24 hours a day, 7 days a week. Now, if you have questions, send them to me through the website. I'm more than happy to answer them for you. If you want to listen to podcasts, we have well over 1,000 hours of audios and videos on the website, drjoe.com. Also, if you have Stitcher or the other podcast services, it's called For the Health of It, which is the title of my first book, Eating Right for the Health of It. So For the Health of It is the name of our podcast, and you can tune in there and you can binge listen if you want, either on the website or on your podcast services. And again, the website, drjoe.com. Heart disease. You may remember prescription painkillers that were pulled from the market a while ago. The reason? They cause heart attacks, but they're not the only one. All nonsteroidal anti-inflammatories pose a heart risk. Might be minor, but it's there. So be careful with that. And the other thing I want to talk about, too, we got a lot to talk about. I'll never cover everything today. I got so many notes on chronic pain because I'm a chiropractor. I'm board certified in chiropractic, orthopedics. I think I'm the only chiropractor in my state board certified in pain management. I'm double board certified in nutrition, BS in nutrition. So I get excited about pain patients because we see so many of them. And boy, is it ever nice when you get somebody out of pain. And they're just so grateful. They want to name their kids after you. And I've had a few who want to name their kids after me. Yeah, now that I think about it. I was going to joke about that, but it's true. But we want to get the body healthy. And from a chiropractic standpoint, we don't use drugs in surgery. We use the non-drug, non-surgical approach. And we do have a team of doctors that we work with that are medical experts that we can refer to. And they refer to us. And lawyers refer to us all the time. Because patients in car accidents and workers' comp injuries, they want to come see us as well. Because the studies have shown chiropractic care, done properly, is more effective, gets people back to work faster with less downtime for way less money. I don't know where that's a no-brainer as far as I'm concerned. Why that's ever a question. If there's a back pain, neck pain, any pain patient, get them to the chiropractor. It's going to save you money, time, and usually gets better results. Now, if it's not a chiropractic case, we'll tell you that too, and we'll refer you out as well. So we're talking today about some of the over-the-counter medications, why they're dangerous, and the main topic is chronic pain patients. What do you do about it? Hypersensitization, and this is a biggie. Painkillers can heighten your susceptibility to pain. While this phenomenon has been seen mostly in prescription opioids, which is what we talked about earlier, studies have shown that acetaminophen and nonsteroidal anti-inflammatories can do the same effect on headaches. It's called a rebound headache. And we've had a lot of patients over the years come in, migraine sufferers, headache sufferers. They dull your response to pain, so you need more medication to get the same results. You end up becoming increased sensitivity to the pain. So what are you supposed to do? You're going to grin and bear it? No, I don't want to do that. I want you to get to the cause of the problem. Now, occasional use is fine. What's occasional use? Less than once a week. If you have to do it, you have to do it. But if you have pain that requires take over-the-counter medication on a regular basis, you need to seek attention from a qualified healthcare professional. And of course, my team of doctors and I certainly consider some of the most qualified healthcare professionals in the world to get to the cause of your problem. Now, painkillers. We're not just dealing with pain, we're dealing with a lot of other health issues. So doctors, you have to start looking for pain as a symptom, not as a disease. This is what I teach when I teach postgraduate work to chiropractors, medical doctors. When I teach as a school, I'm a guest lecturer at a lot of colleges. Always look at pain as something good. Why is the pain here? And what can we do not to cover up the pain, but to get rid of the cause? Much better way to look at your life, I think. And most people are pretty happy with that result. Now, as a nutritionist, I told you to talk about nutrition. I told you I'd get there. A lot of people come to us, and I look at their diets, and their diets are just atrocious. They're eating things like alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, many times exclusively. There are no fruits, vegetables, nuts, and seeds. So when that occurs, I have to sit down with the patient and say, listen, you've got a back injury. You were in a car accident. You've got numbness, tingling, headaches. We have to then say, what can you do to help deal with the problem? Because we can treat you in the office, but you have control of your diet. And so if you're eating inflammatory foods like sugar, causes inflammation, meats, dairy products, inflammatory, all the 7 deadly sins are inflammatory foods. We got to start cutting back or cutting out, that's New Jersey, isn't it? We're cutting it out. Cutting out the inflammatory foods, and then the chiropractic care, the physical therapy, the shots you may have, the drugs are going to work much more effectively. So, cut back the bad foods. Get on an anti-inflammatory diet. What does that look like? Fruits, vegetables, nuts, and seeds. Dr. Joe's Super Greens, Dr. Joe's Essential Source are spectacular to help alkalize the system, get some of the acid out of the diet, and neutralize a lot of those toxins. So if you know what Dr. Joe's Super Greens and Essential Source are, they're 2 products. I created them years ago for myself, actually, and now they're hugely popular all over the world. They're 2 powders. One is dried fruits and vegetables in a powder form, prebiotics, probiotics, digestive enzymes, and a complete multivitamin. The other one, Super Greens, wheatgrass, barley grass, alfalfa grass, chlorella, spirulina. We alkalize your system. And we alkalize the system, it brings down the inflammation. We also have Dr. Joe's adrenal support because the adrenals help control prostaglandins. Remember prostaglandins 10 minutes ago? They moderate and they mediate inflammation. So we got to get the adrenal glands working. We got to get the gut working. We have Dr. Joe's probiotics, which are good bacteria to recolonate your colon after the medication you took destroys it. So Super Greens, Essential Source, adrenals, and probiotics would be my approach. And I want to talk about vitamin D because so many of you are deficient in vitamin D. And when patients come in, many times they'll have blood work done. And the blood work will say, I'm deficient in vitamin D. I had one lady come in the other day. She goes, I have 0 vitamin D. I said, well, you can't have 0. You'd be dead. But she's very, very low. And the doctor prescribed her vitamin D2. Vitamin D2 is the synthetic version of vitamin D3. So D2 has to be converted into D3, and usually they give you 50,000 international units once a week. I don't like that approach. I'm not a medical doctor. I'm not telling you to take drugs or not take drugs. My approach is let's take the form that your body needs, which is vitamin D3. It doesn't have to be converted from D2. And let's take a little bit every day. So what I tell my patients, my pain patients, I'll make sure their vitamin D is where it should be. And if it's not, we get them on Dr. Joe's vitamin D. And we also add vitamin K2 to the D3 because that helps build bones. So I tell them 5,000 international units, which, by the way, for my product is 5 drops. 5 drops every day. And now we can rebuild the stores of vitamin D3, not just D2, and then get out in the sun. 20 minutes of sunlight is going to give you 20,000 international units of vitamin D. So if you go, maybe a tank top or a short sleeve shirt, a V-neck with your face and arms exposed, some shorts, 15, 20 minutes a day is going to give you the vitamin D that you need for the day. 20,000 international units of safe D3. And by the way, don't go out in the sun and then shower right away because it's on your skin. The UVB rays interact with cholesterol on your skin, and that's why you get a little greasy after you're out in the sun. That's the vitamin D being formed. Don't wash it off right away. Leave it on as long as you can. Go a whole day without a shower, that'd be great. It's going to give your body a chance to absorb more D3. Folks, going to have to go to break. If you want to make an appointment to come see us, we have offices in Marietta, Duluth, and Stockbridge. If you want to order the Dr. Joe Super Greens, Essential Source, Probiotics, Adrenal Support, the Vitamin D, we have a bunch of other products. They're all on the website, drjoe.com. We also have Amazon as well. If you have an Amazon account, you can order them there. If you want to make an appointment, stop suffering. Make the appointment. So many people suffer, and the biggest complaint I get, by far, been doing this for 33 years in practice, plus my schooling. Why didn't I do this sooner? Why didn't somebody else tell me that this is what I can do for chronic pain? And my answer is always, I don't know. But now you know. Don't make an excuse. drjoe.com, make an appointment. You, your friends, your family, your children. If you've ever been in a car accident, if the car was damaged, you were damaged too. I don't care what the insurance companies say. Don't let the insurance companies dictate your health. Thanks for listening. We'll catch you next time. Thanks for listening to For the Health Fit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.